Okay, so and just to finish up, you mentioned that you do. But let me ask you a question about the swelling aspect of the rhinoplasty. Um, does the nose start to swell while you're in the OR, while you still have the nose open, or if you're just closing it? I mean, does that in any way kind of maybe give you a false idea, or if I mean, just elaborate on the swelling and how fast does it come on?
Well, initially during the operation, what we do is we inject lidocaine, novocaine, into the nose to shrink the blood vessels so we don't get so much bleeding, and to give some anesthesia even though patients may be under anesthesia already. So that in itself is inducing swelling because you're injecting fluid, and it's basically changing the way the nose looks. So right there and then, before the surgery has started, there's changes that are occurring. And you do get swelling, if you spend 2 to 3 or 4 hours of operating, and if you're doing very, major revisional work, you're getting more and more swelling at the time of the surgery. But if you have structural foundation, meaning the surgery that you're doing is structurally supporting the nose, you can have with a fairly good certainty what the nose is looking like, albeit there is fluid and there is some distortion of the tissues. Now, after the surgery, in the first 72 hours, there's a significant increase in the amount of swelling because all the blood cells are coming in. They're seeing trauma in a sense. They don't know that we're doing this for aesthetic reasons. Right. The body sees it as a trauma. So swelling significantly increases in the first 72 hours, and then it starts going down after that. And then there's long-term swelling. That's the immediate swelling. Long-term swelling is basically the way that the body and the nose heals itself, and that could take anywhere between 12 to 18 months, sometimes even longer, depending on the complexity of the surgery, the ethnicity, the skin thickness, and the complexity of the operation.
Okay, I want to elaborate a little bit on the swelling, because this is very important for a lot of the visitors to our website. A lot of the questions we get on the swelling. After the 1 year mark, well, I'll ask you, what is the swelling process and how long does it go over? Like, for example, do you still have 50% swelling at the 6 month mark? What is the percentage with regards to the swelling as the year goes through? For example, how much swelling can somebody expect at the 9 month mark as opposed to the 3rd month versus the 9th mark, or 9 month?
Swelling depends on a significant number of factors. Everybody is going to be different. First of all, if you're doing an open versus closed operation, the ethnicity of the patient, which relates to skin thickness, the complexity of the operation. If you're doing rib grafts, cartilage grafts, revisions, you're separating the cartilage from the underlying mucosa, from the overlying skin. All of these will have a tremendous impact on the swelling of the operation, and also the meticulousness of the operation. Using nice tissue planes, using injections that will reduce the blood supply to the nose at the time of the surgery. All of these will make an impact. So on average, for primary rhinoplasty, 90% of the swelling goes away in the first 3 to 4 weeks.
Okay.
That last 10% typically takes about 1% per month. That's on average. Now, if you have a very thick-skinned individual, it's going to be longer. If you have a revision, it's going to be longer. That's typically the swelling process. Now, there is a secondary healing process that's completely separate from the swelling process. So if you've done what we call reduction rhinoplasty, where a lot of cartilage has been removed, there's no support for the nose, that secondary healing process will continue for a long time because the nose doesn't have any support, and the skin continues to collapse around these weak cartilages. Then you start getting pointy tips and irregularities and polybeak deformities where there's a little bulge in the above the tip of the nose, and you start getting irregularities. So that's a little bit different than just the primary swelling that we see oftentimes after surgery.
Okay. In the beginning, you mentioned closed versus open. Well, before we get to that, let me go back a little bit. One of the few, well, we get some of these questions a lot with regards to swelling. Having alcohol, like we have people that email us asking us, I went out for New Year's or for a party or Christmas, and had a few glasses of wine or alcohol, and I noticed my nose in the morning was significantly bigger. Now that swelling comes down as the day goes through, but do things like salt and alcohol and things like that, do they make your nose bigger, or is that just the people are just maybe they're being a little overzealous with regards to their nose?
No, I do believe that salt intake, dehydration, and effects of alcohol do make an impact, especially in that first year,
right,
when you do have some swelling in your nose and some fluid buildup. And again, depends on the thickness of your skin and so forth. I do think it does make a difference. Also, if you've had alloderm in your nose or fascia in your nose in that first year, that tends to attract water, so you end up getting swelling a lot more in individuals who have other tissue parts inside their nose. So yes, it does, I think, make an impact.
Now, I mentioned a little bit earlier the open versus closed. Can you elaborate on that? And even with regards, since we're on the swelling topic, can you elaborate the closed versus open, and if one has more swelling than the other? And for example, when do you do an open versus a closed? Do you use closed for primary revision, open for revision? Please elaborate on that.
Well, open versus closed, that topic has been going on with our patients for, I would say, now 2 decades.
Okay.
It's been about 20 years. In the late 80s, open techniques started coming into more and more widespread use, and closed ended up going lower. And over the last 5 years, there's been a much better balance, because I think about 5 to 10 years ago, people were all doing open rhinoplasty. Even for if there was a little hump reduction, bridge issue, people would do open rhinoplasty. So clearly today, I think the experienced surgeons need to really know how to do both. However, for the patient, the most important thing is, what does your surgeon recommend? Okay, because there are patients I get all the time saying, I'm only looking for a closed rhinoplasty. I think that's a mistake. The better question is, what do you, as my surgeon, think is the best option for me? And if your surgeon has the ability to do both, then they're going to be able to give you the options that are best for you. Now, if there's complex tip work that requires to be done, I really don't believe that a closed approach can address complex tip reconstruction. Now, there are maybe 1 or 2 surgeons around the country who are able to accomplish complex tip reconstructions using a closed approach, but that's not too many people can do that. Most of the very experienced and expert rhinoplasty and revision rhinoplasty experts use an open approach for complex tip work. For bridge work, pretty much open or closed can accomplish even complex bridge work and bridge reconstruction. And in some cases, it's even better. For example, if we just want to build someone's bridge who's been over resected during surgery, and in a revision rhinoplasty, we want to do a rib graft and build the bridge up, sometimes it's much better and you get a better result if you're doing it closed, because you could create the pocket that you want, the graft can go in very nicely, and you have a very, very nice and stable structure. And sometimes you need to do it open. So it all depends on the necessity of what you require. So the question should be, from your surgeon, do you do open and closed? And what would you recommend? If your surgeon is comfortable with doing only closed rhinoplasty, you don't want to force them to open your nose. They're going to get a terrible result, and vice versa.